Hi, I'm Dr. Jennifer Bennett from Curative Medicine, and I just wanted to tell you a little bit about our story of how Curative Medicine was created, a little bit about my background information, and why I'm so passionate about compounding. So I was a young mom, and I had a 2-year-old son, and had to decide what I was going to do with my life, and decided that I wanted to do something to help people, and I also wanted to do something that could help take care of my family to the best possible way that I knew how. So I went back to college. I went to pharmacy school at Mercer University in Atlanta, and I just continued along this path. I really had no idea what this path of pharmacy was going to lead to. I found a lot of interest in compounding while I was in school, and I did take an independent pharmacy ownership class by Dr. Jackson at Mercer University, and that was where the idea is, maybe one day I could have my own pharmacy. Didn't think about it again for many, many years later. And when I graduated, my Aunt Susan, who lived in Jacks Beach, she had a friend who had a compounding pharmacy that needed some help. So she put us in connection, went to the interview, was given the job, which was great. And I learned so much at that job, hands-on, working with the technicians and the owner and just doing trainings on my own and talking to the patients. So I just learned a lot during that process. But as life happens, we had to relocate to North Florida, and I ended up taking a job in Lake City working for another independent pharmacy where I was given the task to create the compounding department at that pharmacy. So I continued just to grow my knowledge. I went to classes, talked with patients, really just created a lot of formulas based out of problem solving for the patients of what they needed, and on also combining my knowledge of what medications could work together, what dosage forms were appropriate. In that process of creating this compounding department, I also realized the value and importance of having the pharmacist, the provider, and the patient all working together to collaborate for the greatest outcome of the patient care. I saw patients really thrive. Their health outcomes were almost always achieved, and if there was ever any issues, we would troubleshoot them, the provider and the pharmacist, or me. We would troubleshoot them, and we would talk with the patient, we would get their input, and we would come up with formulas that were really customized and tailored for them. And I love this part of compounding. To me, this is the bread and butter of why it's so important for patient care, is the collaborations between the pharmacist and the provider and the patient, where everyone works together for the greatest outcome of the patient. I continued to work at this pharmacy for 14 years, which is a long time, and I grew formulas and had different ideas and grew relationships with providers. And I just had this idea that I really wanted to create a pharmacy built upon these foundations that I already explained, but also that had a family environment for the employees, because I realized that it's really important to have a healthy work environment for staff and for the owners or for management. Everyone needs a healthy work environment where the teamwork is really the foundation for success. So that became another added layer of why I wanted to open this pharmacy, and so that's where Curative Medicine was born. So after all of this background information, you may be wondering, what the heck is compounding? So compounding is creating custom medications by mixing, altering, or combining ingredients that don't exist and they meet the specific needs of the patient. So this practice allows pharmacists and their staff to create prescriptions that are not available in standard commercial forms. And this is creating like a liquid form of a medication for someone who can't swallow the pills, and there is no liquid form that you can just get that's commercially available. So that's one good example. Another example is for a child who cannot swallow or cannot take an antibiotic. They are vomiting every time with each dose, or they just are fighting their parents really bad. They won't take the medication and the child is just really, really sick. So we can also combine antibiotics into a rectal suppository, and that gets really good systemic absorption to treat the infection. And it's not something that you can just get at any pharmacy. It has to be custom created. So see the link below for more information about compounding, what that might be as far as a general term, and then also for more specifics about what we do here at Curative Medicine. We're on all the socials, so you can see all of the fun different things that we do, products that we create, and our staff and our environment that we have. And also check out our website. We have an online vitamin shop, and you can also send email and be happy to answer any questions or give us a call.